Touch his face.
Okay.
Welcome everyone. Dr. Sultan. Today our log case of this patient, Mr. Kalina, 50 years, London, belongs to second. He came with the chief complaint of weakness in the lower limbs for the last 10 days. The weakness started suddenly in onset, and it was intensified and progressively increased. And within 24 to 48 hours, he was unable to walk around and he used to take support. The weakness doesn't resolve with anything. Instead, it is progressive weakness started from the lower limb and is progressively going upward. But weakness does not resolve with anything. Besides weakness, patient has no other significant complaints of like headache or incontinence of the urine and flares, no bowels. Patient has pure motor weakness. The patient has in past a similar sort of event for which he was admitted in the hospital and has to take treatment. Patient has no previous history of any coryza, upper respiratory tract infection or lower respiratory tract infection, and there was no diarrhea prior to this illness. It was all sudden within last 10 days. The patient is admitted in this hospital 4 days back through emergency, and after that he has had lumbar spine MRI, X-ray and other investigations. Upon history, he further revealed that he has had the similar symptom 5 years back for which he has taken plasmapheresis 4 sessions. Now, patient denies any other disease like diabetes or tuberculosis, ischemic heart disease, and he has no other medical complaints. There is no known allergy to him. The medication, he also confirms that he used to take a herbal or a key medicine. The bowel and bladder are intact, and patient has no history of smoking, alcohol, and any other major activities. There is no history of IV drug abuse, alcohol, tobacco. Patient lives in a Pakka house with 4 rooms and 8 family members. He is the breadwinner of his family. But this disease during last 10 days has an impact on his job and living both. On systemic inquiry, there is no headache, no vertigo, no tinnitus, no bulbar or pseudobulbar element. Respiratory rate is normal, that is 20 to 25 per minute. Vitally is stable, 120 by 80. There is pulse bilaterally, no pulse character is normal. Rate is 72 per minute. There is no radial delay, radiofemoral delay, and patient is afebrile as well. Further examination of the patient has very good mental score, that is more than the 21 mental score. He is good in speech, can understand, can communicate, and there is no signs of distress in this patient. Cranial nerve examination we perform. The cranial nerve examination which we perform as direct light reflex, consensual reflex. The normal is having, he feels the smell of things. Third, fourth, sixth nerve, there is no ophthalmoplegia. There is no grimace or the weakness of the facial muscles. He can uplift the eyebrows, can make wrinkles on the forehead, can clench the teeth, clench the jaw. Patient can whistle. There is polynormal gag reflex, and he can shrug his shoulder. He can roll out in bed very comfortably. While the lower limb examination, especially the motor examination, power is 2/5 in the distal lower limb as well as the proximal lower limb. The tone is hypotonia, having power 2/5. Reflexes, hyporeflexia in both bilateral ankle and bilateral knee joint. The joint position sense, fine touch and sharp touch, they are not intact. There is a sensory level 80-10 in the spine. In the upper limb, tone, power and reflexes are normal. So there is no weakness in the upper limb. There is lower motor neuron bilateral paralysis in the lower limb with a sensory level. So this was my with intact bowel and bladder reflexes. So my most probable differential diagnosis in this patient is acute motor and sensory axonal neuropathy, variant of GBS in this patient. Besides this, what are other differentials?
We could think of hereditary
diseases,
sensory neuropathies, motor sensory neuropathy.
acute intermittent porphyria, the lower motor neuron,
We could think
that there is no sensory level in that. Sensory level always show that there is spinal involvement. So therefore that is our only diagnosis, the GBS variant, that is acute motor sensory axonal neuropathy. Thank you very much.